Hi friends, this is Dr. Rohan Virani from Trisa Dental Solutions, Bombay. Now every day I am getting a lot of people asking us, I have this problem, when is your clinic opening? You have this dental emergency, when is your clinic opening? So I can understand how frustrating it must be for so many of you who are at home, not able to get out and having some or the other dental issue. So I thought I will make a small video to just help you all what you can do sitting at home in this testing times of COVID. So there are some people where the dental crown has been put many years back and it has just popped out in the mouth for some reason. Now the best you can do is just preserve it in a box. Please friends, don't try to put it or stick it back in your mouth. Otherwise it will just pop out, and if it goes down your windpipe, you will be in a bigger emergency. There are some senior citizens whose dentures have become loose. They are not able to eat or enjoy their food. What you can do is just go to the pharmacy and buy a fix-on denture adhesive. This denture adhesive you can simply put inside the denture and hold it in your mouth for 10 seconds. And you will see a significant improve in the grip of the denture, and your senior citizens who are stuck up can easily start eating their food again. Because of this stressful environment, lot of people are developing stress ulcers in the mouth. These ulcers are very painful and you are not able to enjoy the food. What you can do is just have mucopain gel. Just buy mucopain gel, which is available in the pharmacy, MUCOPAIN, and apply it over the ulcer 4 to 5 times a day just before your meals, and you will see that you can easily enjoy your food again. Most of these ulcers will easily go in 3 to 4 days time. Now there are some people who are having some kind of a pain in their teeth. Now if it is just sensitivity, you can try Colgate Sensitive or Vantage toothpaste and it should subside. Extreme hot or extreme cold temperatures, if it is troubling you, it is common sense, just simply avoid it. If the pain is a nagging pain, you can try Crocin or Combiflam tablet, which most of us are keeping at home. Now mind you, Combiflam tablet, asthmatics should not have, but most of you will get relief by having Crocin or Combiflam tablet 2 times a day. If the pain is very severe, friends, I am sharing my number with this video. Please feel free to get in touch with me or your dentist, who will prescribe you something over the phone to help you out. In some cases, people are having swelling along with the pain. Now if there is swelling, please don't apply heat on the swelling, it will spread more. Try to apply ice and get in touch with us or with your dentist, who will prescribe some antibiotics to help you. Now some swelling, they go very big. If the swelling has grown below the lower jaw, okay, just below this border, and it is approaching your throat, please go to the nearest hospital. There are some conditions called Ludwig's angina where the infection can spread into the windpipe. So please don't delay the treatment in such cases. In some cases, the food is getting stuck in small spaces or in small cavities. Friends, you can use this interdental brush. It's called a Proxa brush. It's called a Proxa brush. You can use it like an interdental brush directly between your teeth like this. Okay, and that will take care of whatever food is stuck, and you will get good relief from your pain. Now there are some kids, they are playing at the house, getting hurt, there is bleeding, and what happens normally, we panic. What you should do is just remain calm and take some cotton, okay, or if you have ice, you can put it in some cloth and compress that area. If the mistake we are doing is we are checking if the bleeding has stopped. Friends, the bleeding will never stop like this. For the bleeding to stop, you have to keep the compression on for at least 10 minutes. Just keep it hold and don't try to move. Just keep a good compression and you will see 90% of the bleedings will stop with good compression. If the bleeding persists, obviously you have to go to the nearest hospital, but in most cases the bleeding will stop. So I just thought I will make this video and help you out with some of the dental emergencies which you can simply tackle yourself at home. If there is a severe problem, feel free to get in touch on the number provided on this screen or get in touch with your doctor. But most important, be home, be safe.